Welcome back to 𝗏𝗏 City. Today we have an amazing stars here at Mediclinic in the Rome and in the field of rheumatology. I'd like you ladies to introduce yourself. Doctora?
Right, so I'm Maisam Musgrave. I'm a consultant rheumatologist here at City, and I also work at Community Hospital.
Excellent. Welcome. Doctora?
Thanks, Sajid, for having us here. I'm Amel Ginawi. I'm a consultant rheumatologist. I'm the second rheumatologist in City Hospital, and I work with Maisam closely.
Excellent. Welcome. So, Doctora Maisam, can you tell us a little bit about what is osteoporosis and why is it important?
All right, so I'll start with the word osteoporosis. So it's very simply put, it just means fragile, brittle bones that are easily broken. So if a person's got osteoporosis, for instance, we know that he's got a condition or she's got a condition that has very fragile bones.
Sure.
And unfortunately, that means they're very liable, or they're at risk of fracture or fragility fractures. If I elaborate a little bit more about what fragility fracture means, it means that if you fall from a standing height, you're very liable to break a bone, a hip, or a wrist or a spine. So, for instance, if I come in and I consider myself having normal bones, if I stumble and I fall, I should be okay to get up. But if somebody comes in and has got osteoporosis and trips, falls on their hip, then they can break their bones. And so a lot of our patients will ask me sometimes what is that process? Why does that happen? So I would say, look, our bones are healthy tissue. So it's a constant state of remodeling. So you have bone cells that build bones and you have cells that break down bones. When you have osteoporosis, that equilibrium is disrupted. So you find that the bone-eating cells are more active, resulting in very fragile bones.
And what is the importance of osteoporosis?
Right. Okay. So when someone's got osteoporosis, no, but they don't know they have it. It's a very silent condition. So it's important to be more aware of it because people don't know they have it until they break bones. And unfortunately, that's a bit too late.
Wow.
And interesting, and I'll tell you a very interesting statistics, Sajja, is that at the moment, every 3 seconds, somebody in the world has breaking their bones.
Wow.
So in the last 5 minutes, that's about what? 20 people have broken their bones.
Amazing. Oh my God.
And unfortunately, if you break a bone from osteoporosis, within the next year, 20% of these people will have another bone that's broken. And that's very
In the same person.
In the same person. And in the UAE, the prevalence of osteoporosis is around 3%. And for a population of about 10 million, I think we're 9 to 10 million, that's quite significant.
That is significant. Amazing. Doctora Amel, can you shed light on the key factors that influence the developments of osteoporosis?
Yeah, sure, Saja. So osteoporosis is a disease, we call it a disease that occurs in women above the age of 50 or postmenopausal women when the change in life happens.
Sure.
And this is because the estrogen, our hormone, the woman hormone, is protective and controls the bone-eating cells that Maisam has mentioned. So as women go through menopause and the estrogen gets less, then this protective mechanism of the estrogen is completely gone, and therefore there is more bone eating that leads to osteoporosis. And also we say it's a disease of women, but men also can get osteoporosis. So we mustn't forget the men.
Yes.
And so this is the first important factor is postmenopausal women or postmenopause in women. And the other second factor, as mentioned is a history of an osteoporotic fracture.
I see.
So if someone has a history of an osteoporotic fracture, it's likely that this will increase the risk of developing another fracture. Age, as we get older, as we get crinkles and we get gray hairs.
That's the blessing.
And then we also, the bones get thinner, as well as frailty with age, the muscles get weaker, falls become more likely, and this may increase the risk of fracture. Then we have lifestyle measures. Excess alcohol, smoking can lead to low bone density. Drugs also sometimes can affect the osteoporosis and the bone. The commonest one that we worry about is steroids and medication that is given to breast cancer and also prostate cancer. So our colleagues in the oncology department always usually refer us patients for the assessment of their bone when they are considering starting these medications.
I see.
Another factor that I want to mention is the family history. There is genetics. Sometimes we investigate patients, we don't get any reason why they are having osteoporosis, but there is the genetic factor. So if it is in the family, if it's especially in the mother side of the family, or if someone in the family has broken their hip at an older age, this makes us think about osteoporosis. I left the last most important factor, I think, is vitamin D deficiency. We live here in a country where we have abundant sunshine, which is the source of vitamin D.
Sure.
However, we are deficient in vitamin D, and vitamin D, we need it for healthy bones because it's required for the transport of calcium to bone. And obviously, if we don't have the vitamin D, the calcium will not go to the bone to strengthen the bone. So these are some of the factors that we consider important in having osteoporosis.
And amazing that you shed light on smoking, because a lot of patients don't even know that smoking could cause even osteoporosis. So that's amazing.
Yes.
So Dr. Maisam, can you tell us, how do you diagnose osteoporosis?
Okay, so very simple. And we're very fortunate here in City that we have a DEXA scan. So this is a special scan that basically takes pictures of the spine and the hip. Sometimes they take pictures of the wrist, but not very often. And it involves a very minute amount of radiation. And I think a lot of patients worry about radiation, but it's very minimum. And the beauty of these DEXA scan gives you the results instantaneously. So when we get the results of the scan, we put into account what Dr. Amel said about the risk factors. So we look into that as well. We also do some blood tests. So we incorporate that all together, the diagnosis. But also within the DEXA and in City, we have a specific software that also not only allows us to know the density of the bone, but it also looks at the quality of the bone.
I see.
So it's two with one stone.
I see. Excellent, excellent. So we've diagnosed osteoporosis now. Dr. Amel, can you shed light on how you're going to manage it and how are we going to be able to reverse it?
Now, as Maisam said, the main worry about osteoporosis is the fragility fracture, the fracture that occurs from minimal trauma and sometimes no trauma at all. I've had one patient, for example, Saja, who was just standing in the queue to pay for in the till, and she broke into vertebra. So that shows how serious the disease can be.
Amazing.
So in treatment for osteoporosis, we need to prevent the fractures from happening. And the good news is we do have medications that are able to reduce the risk of fracture by almost 85%. This is a significant figure. So we have treatment, try it, test it, and trust it. And in addition to that, we have also, we know that we can also prevent the osteoporosis from occurring. But also these treatments we have that either work on preventing osteoporosis by increasing the the bone building cell activity or reducing the bone eating activity. We have medications that come in tablet form. We have medication that also are injectable either at home or in the hospital. So we assess the patient, and depending on how bad the osteoporosis is, if I may say, then we can suggest the treatment. But what the message I want to say is that we have good treatment. We can prevent it from getting worse. Unfortunately, we might not be able to revert the damage that has already happened, but we definitely can stop it from getting worse in the future. And but the treatment is long term. So we do need the commitment from the patient, the compliance, and also in understanding how the treatment works.
Of course. And you shed light on the medication and how we can prevent it and also manage it. But is there any lifestyle modification that I or any other women or men do to prevent osteoporosis?
You know what the key word is, Saja? Prevent. The prevention is better than cure, as we know with all our diseases. And it's no different in osteoporosis. So what we do really know now is that we reach our peak bone mass around the mid-30s, and that's for males and females. So we really need to invest in building our bones early on. So in that window of opportunity, for our children, our brothers, our sisters, our family members, we just really need to make them aware that this is the time that you have to eat healthy. So you have to make sure that you have calcium-rich food, you optimize your vitamin D, get exposed to the sun within reason, obviously, and then exercise. exercise, exercise, exercise. So this is the time when you really want to build that bone mass, make it nice and strong and compact. So these are the things that I would focus on as well. I remember a very famous quote that we were told in our training is that osteoporosis is basically a pediatric condition that manifests later on in the old age. So we really have to look after our bones early on.
No, absolutely.
Can I just highlight a few more things? So you know how you were talking about smoking and you're talking about drinking?
Yeah.
Again, these have a direct negative effect on bone. So really we need to, cut that back or stop it completely.
Sure.
Eat healthy with proteins because proteins are the building blocks for that strong bones that we really want.
I certainly got inspired today by all these information. So I would like to get my vitamin D and DEXA scan done. Do you have any packages for that here at City Hospital?
We actually do, Seja, and it's ongoing now, but we have a package where you can check your vitamin D and we do the DEXA scan, what we call a one-stop visit. So you have your vitamin D done, DEXA scan done at the same time, and you see one of us, either Maisam or myself, and we tell you about the result of the vitamin D, the result of the DEXA scan, when we give you the whole advice about how to look for after your bones.
Excellent. This has been so inspiring, and I'm sure the ladies out there and the men will come in and have their scans done. Thank you so much for watching. This has been inspiring. Stay tuned till next episode.